The thigh supports can be adjusted in or out as shown. This serves two different purposes. The first and obvious purpose is to adjust for the size of your thigh. Since your leg consists of soft, compressible flesh, you need to adjust the thigh supports slightly smaller than your actual leg circumference. They should press firmly into your upper leg. This prevents excessive movement and stabilizes the crutch. Another adjustment, which is less obvious, but equally important, is to align the crutch to correct for valgus or varus leg configurations. This is achieved by using asymmetrical settings. In this example, we'll use a person's right leg. Adjustments for the left leg would be exactly the opposite. A valgus correction would position the crutch toward the inside of your upper thigh. A varus correction would be exactly the opposite. You adjust the thigh supports so that the upper crutch is positioned more towards the outside of your thigh. Let's show you what this looks like with the crutch being worn. So, if you're straight-legged, then you adjust the thigh supports symmetrically. This will position the crutch foot right about where your human foot would have been. Since the crutch recruits only your upper leg for alignment, look what happens when a person is varus or bow-legged. The upper leg angles outward and the crutch follows this angle to the ground, which causes the foot to be outboard of where your body expects it to be. This setting is very stable, but not very efficient for walking. To correct this, you need to realign the crutch. This is done by adjusting the thigh supports so that they are asymmetrical, as shown here. Notice that this repositions the upper crutch further outward on your upper thigh. The crutch pivots at your knee and the foot repositions itself to where your human foot normally have been, which restores your balance. Most of us, however, and women in particular, tend to be valgus to some degree. For valgus correction, you do exactly the opposite. If you are valgus, the upper leg angles in, so if the thigh supports are adjusted symmetrically, the crutch will angle inward. Notice that the crutch foot is now closer to your body's center line, which will throw off your balance, especially when you lift your human foot to bring it from back to front. This is going to feel very unstable. Luckily, there's an easy fix. Reposition the thigh supports asymmetrically as shown to draw the upper crutch so it's more inward on your upper thigh. The crutch will pivot at your knee and the foot will be repositioned to where your human foot would have been. Now the crutch will feel stable and natural. The vertical alignment of the crutch will make a significant difference in how the crutch operates. Remember that the goal of aligning your crutch is to position the crutch foot where your human foot would have been. So, whether you're straight-legged, valgus, varus, or somewhere in between, the iWALK 2.0 has adjustments to accommodate your situation.